A sinus infection occurs when the tissue in the sinuses swells up. This leads to a buildup of mucus, pain, and discomfort. The sinuses are the air-filled pockets in the bones of the face that form the top part of the respiratory tract. These pockets run from the nose into the throat. A sinus infection may be caused by anything that stops the sinuses from draining, such as the common cold, hay fever, exposure to allergens, non-allergic rhinitis, and changes in air pressure. So, how long does a sinus infection last? A sinus infection has similar symptoms to a common cold. The big difference between the two is how long those symptoms linger. Sinusitis symptoms typically last no longer than 10 days. Chronic sinusitis can last for 12 weeks or longer. Sinus infections almost always get better on their own. Antibiotics won't help a sinus infection caused by a virus or an airborne irritation, like secondhand smoke. But there are some things you can do to try to speed up the recovery process. Drink plenty of water. To help flush the virus out of your system, make sure you're adequately hydrated. Aim to drink at least 8 ounces of water every 2 hours. Eat foods with antibacterial properties. To fight the virus, add antibacterial foods like garlic, ginger, and onions to your meals. You can also try drinking ginger tea. Add raw honey for an extra boost. Honey is packed with antioxidants and has antibacterial and antifungal properties. Add moisture. Keeping your sinuses hydrated can help relieve pressure. Here are some tips for hydrating your sinuses. At night, sleep with a humidifier in your bedroom to help relieve nighttime nasal blockages. During the day and before bed, use natural saline nasal sprays. These can be purchased from your local drugstore and used several times a day to help break up congestion. Avoid sprays that contain oxymetazoline because you can become dependent on this spray. Your local health food store will have natural alternatives. Expose your sinuses to steam. Take regular hot showers and breathe in the damp air. You can also fill a bowl with boiling water and lean over it for 10 minutes. Cover both your head and the bowl with a thick towel. Keep your nose 10 inches above the water. Are you enjoying the video so far? If so, hit the like button and subscribe to the channel. We have much more healthy content. Where this came from. Clear the sinuses with oils. Eucalyptus oil can help open up the sinuses and get rid of mucus. One study has found that the main ingredient in eucalyptus oil, sinusitis, helped people with acute sinusitis recover faster. To alleviate sinus or upper respiratory infections, use eucalyptus oil externally on the temples or chest, or inhaled via a diffuser when the oil is added to boiling water. Make sure you only use food-grade essential oils. Rub 1 drop of each oil on the roof of your mouth, then drink a glass of water. Use a neti pot. Nasal irrigation is a process often used to ease the symptoms of sinusitis. According to recent research, using a neti pot with a saline solution can get rid of some symptoms of chronic sinusitis. Follow the directions supplied with your specific neti pot. Here are some general directions. Fill the pot with the saline solution. Incline your head over the sink at a 45-degree angle. Insert the spout of the pot into your top nostril. Carefully pour the saline solution down that nostril. Repeat the process with the other nostril. Be careful to sanitize your neti pot after every use. Only use distilled water. Water straight from the sink may have contaminants, like bacteria or parasites, which could make your condition worse. Ease facial pain with a warm. Compresses applying moist, warm heat may help soothe sinus pain. Place warm, damp towels around your nose, cheeks, and eyes to ease facial pain. This will also help clear the nasal passages from the outside. Consult your doctor if you or your child has a temperature higher than 100.4 degrees Fahrenheit, 38 degrees Celsius. Symptoms that have lasted for more than 10 days. Symptoms that are getting worse. Symptoms that aren't eased by OTC medication. You've had several sinus infections over the past year. If you have a sinus infection for 8 weeks or more or have more than 4 sinus infections per year, you may have chronic sinusitis. Common causes of chronic sinusitis are allergies, nasal growths, respiratory tract infections. At this point, it is important to consult your family doctor to determine a plan moving forward. Thanks for watching. If you liked the video, please take a moment to subscribe. Leave a comment with suggestions for future videos. We love giving you actionable health advice and remedies.